Let's switch gears from by-elections now and talk about access to quality healthcare. I'm joined by Dr. Stephen KIGERA, who is the head of quality services at MEDS, and he will tell us what MEDS is. Karibu sana, Daktari.
Thank you very much.
First of all, tell us what MEDS is.
So MEDS is a faith-based organization. So MEDS stands for Mission for Essential Drugs and Supplies. Our core mandates are basically supply chain, quality assurance services, and health system strengthening. So MEDS is actually a product of an ecumenical partnership between the churches of Kenya, that is the Catholic Church, and also the Protestant churches. And it plays a very critical role in the healthcare space in Kenya.
Quite fantastic. Tell us, as being a faith-based organization, how does that influence some of the decisions you make and the operate? Because sometimes there are fears that there's too much bureaucracy and bottlenecks around faith-based organizations that inhibits their efficiency.
I would tend to differ, John, and thank you for that question. So faith is actually the center of, or rather it's the foundation of, it forms a very foundation of our existence and our services. So it's not just a question of how we serve, but also how we do it, or rather, basically how we do it. And we look at our core values. We have innovation, we have customer focus, we have integrity, teamwork, and equity. And what we've done is basically to entrench or ingrain these ecumenical partnerships in our staff, so that when they serve, the services that we offer, the beneficiaries, who are Kenya and its people, are able to benefit from transparent and compassionate service. So bureaucracy is not a part of it.
All right. What you do is similar to what KEMSA does on the part of government. But I want to understand, how do you work with government and private health providers in this supply chain management?
Okay, so our pillars are basically partnerships and diversification. So we first of all partner with government. We've partnered with the Ministry of Health. We have partnered with the county governments, and we've partnered with the government facilities. We've also partnered with our regulator, Pharmacy and Poisons Board. And going back to our core mandate, our core services, that is supply chain, quality assurance services, you'll find that government has procured the services, and our role has then become complementary. So we're helping government to be able to offer services or play its primary role in ensuring that every Kenyan benefits from quality healthcare. So with KEMSA and the other government health facilities, we have combined forces, and we've been able to accentuate both our missions and our visions to be able to make sure that the Kenyan citizen or the Mwananchi benefits from quality.
So you're able to work in collaboration with KEMSA?
Yes, very true.
Okay. Tell us, because supply chain sometimes is inhibited by what you would call sustainability. How do you ensure that there's reliable supply of drugs, particularly to the facilities that you're working with?
All right. So drug shortages can actually be a risk, especially in healthcare delivery. So what we've done as MEDS is to establish a very robust supply chain. One that is founded on the principles of both lean and agile strategies. So what we've done is to make sure that we have a very diverse supplier base. So we work with a big group of suppliers, and we're able to stock up quite easily. We have a very robust drug revolving fund, where we are able to procure medicines and expand our inventory, even responding to emergency cases. And we have been able to partner, especially with the health facilities, to make sure that we meet their needs and their requirements in a timely manner. So we have systems where we're accurately focused, but also taking into consideration their needs and requirements, then we are able to be responsive to what they need from us.
I don't know whether you saw a conversation that was struck yesterday by Abraham Kira. He's actually a member of parliament who just came out of the country for treatment, and he appeared to poke holes in terms of the kind of drugs that sick people in Kenya are taking in terms of quality. How do you work to ensure the quality and safety of drugs as MEDS?
All right, so our tagline is basically driven by quality. We have a very robust quality management system backed by WHO standards and good distribution practices. We have one of the most advanced pharmaceutical quality control labs globally.
Okay.
So what we do is that we use our systems to pre-qualify our vendors, making sure that the sources of our medicines and our health products come from credible and reputable sources. But even over and above that, all products that pass through our supply chain, we make sure that we screen them and test them to make sure that what we are churning out to the health facilities meets the quality requirements. We also work closely with the Pharmacy and Poisons Board in areas of pharmacovigilance so that we get rid of what you call falsified and substandard products within our healthcare system.
And you're the one in charge of the laboratory?
Yes.
Okay. In terms of, when it comes to medical care in Kenya and drugs, for example, it's a very expensive affair. And I'm sure those are complaints you meet every single time in what you do. How do you ensure the affordability of drugs, particularly for the people that you're serving?
That's a very important question.
Yeah.
So for meds, we use and leverage on our size to be able to employ what you call economies of scale.
Okay.
We are able to negotiate better prices from our suppliers because we are able to stock up large volumes of inventory. That way then, we pass that benefit to the health facilities and eventually to the patients. Like I said, we also employ what you call lean strategies. So we have automated our supply chain. We have made sure that we forecast accurately. That way then we reduce wastage within the pipeline, within the supply chain. And more importantly, we make sure that quality products reach our patients. That way then there's no wastage as a result of poor quality medicine or having to recall products. Yeah.
Let me take you back a bit. You talked about a revolving fund.
Drug fund, yes.
Yeah. Where does it come from? From the faith organizations?
No, this was, so the concept of the revolving drug fund was initially developed through a meeting called the Bamako Initiative back in 1988. So what happens is that reliable supply chains are supposed to put aside funds, and those funds are dedicated for the procurement of medicine. That way then suppliers can be paid on a timely basis, and the supply of medicines is not interrupted. So Meds is currently celebrating its 40 years come next year, and we set up this drug revolving fund, and we've kept it healthy all these years, so that when we are to respond to emergency cases and we have to procure large volumes of inventory, we are able to do so by that through that particular fund. And the surplus that we make, a big portion of it is actually channeled back into that drug revolving fund to keep it going throughout the years.
All right. Yeah. Our topic today is towards health quality, and it's a wholesome package beyond the supply of drugs. In a way, do you train health workers?
Yes, we do. Okay. I can say confidently that we have trained many cohorts of healthcare workers. And we do that as a complementary service. It's part of our health system strengthening mandate. The reason why we actually train them is so that they're able to run their health facilities more efficiently, and that benefits is enjoyed by the patient, but also it is also enjoyed by Meds. We train on many topics. We train on topics like rational drug use. We train workers on the importance of procuring affordable medicine. We train them on quality-related topics. In our WHO pre-qualified lab, we have also trained lab scientists, specifically on how to train, or rather how to test medicines. So the cocktail of training programs that we have is quite big. And I think even as I look forward, one of our main strategies is to also set up a supply chain academy. I think I would be correct to say that Meds is actually a center of excellence in training.
Okay, interesting. One of the complaints, of course, you hear, particularly when it involves KEMSA, and of course KEMSA is not here to respond, is sometimes the amount of debt that counties have actually accrued in drugs that have been supplied by KEMSA to county governments or government facilities. Is this a problem you're dealing with in terms of very huge bills or people who've picked drugs from Meds, for example, but then are not able to pay up?
Yes, I would say it is a problem, and I think similar to KEMSA, Meds is not immune to the debt issue. However, the kind of strategies we've employed is to work and partner directly with counties, so that we come up with framework arrangements or we come up with instruments and tools to be able to supply them with drugs on a continuous basis, while at the same time the counties will be able to pay us, so that we again keep that inventory going. It's still a problem, but there are definitely ways of tackling it.
I know there are ways to tackle it. Tell us how you handle it. For example, you're dealing with a county government that is yet to pay up for about 6 months. Do you continue still supplying them with drugs, or what do you do?
All right, so it's looked at on a case-by-case basis.
Okay.
But what we know is that with the partnership that we have the strong partnership that we have with the county governments, that has enabled us to be able to support them continuously with medicine, but at the same time help them to work out their debt debt repayments. And like I said, we use various instruments and strategies to be able to allow them to pay up on a regular basis, and at the same time for us to be able to continue the supplies to them.
All right, we need to put a cap to this. Do you have plans to extend operations beyond Kenya? Because it's a faith-based organization, and particularly when it is linked to the Kenya Conference of Catholic Bishops, the Catholic Church is known for its, what you would say, reaching out to the poor and those probably in troubled areas. Are there plans to extend operations beyond Kenya?
John, I think maybe the question would be in what countries are we operating, because we already are in many countries. I would say that our global footprint is close to about 50 countries. So we've touched and impacted...
Still being called meds?
Yes.
Okay.
Yes, we've impacted populations in close to about 50 countries through our 3 core mandates on supply chain. We have very critical certifications. One of them is recognition by the European Union as a humanitarian procurement center. Okay. So non-governmental organizations who serve in those disaster-stricken areas would come procure from us. We export, and those products will end up mitigating the crisis that is in those countries. I would mention a few countries like Haiti. I would mention countries like Syria and Yemen. In our WHO pre-qualified lab, we have been able to test from 42 countries. In this fight against falsified and substandard medicines, meds is a big ally, and we get samples from all over, and we test, and we are able to serve, especially regulators, to be able to take the necessary steps to get rid of these harmful products.
All right, let me give you your last word on that camera as you put a cap to this, the camera there.
Yes. So, meds celebrating 40 years, and we expect that in the next 40 years, there are big things to come. We are here to stay in the global space and in the global health space, and the beneficiary definitely will be the patient. And we are keen to make sure that every Kenyan has access to reliable, affordable, quality healthcare, health products and technologies. Thank you.
Thank you very much. Dr. Stephen KIGERA, the Head of Quality Services at Meds Kenya. Time for us now to take yet another short breather. When you come back, Doreen Orange is up next with business. Thank you, Dr. for joining us.
Thank you, John, for having me.
Asante. Hold it there.